Hi, welcome to the show again. Today I'm talking to Dr. Jason Scoppa, and I'm going to read a very long intro to properly introduce him and his credentials. I may stumble on a few terms along the way, but we're going to hear Dr. Scoppa explain what they are anyway. So bear with me as I go through these incredible credentials. Dr. Scoppa is the owner of Northwest Structural Medicine, which is located in Bellevue, Washington. He's a passionate and truly holistic doctor that utilizes a variety of treatment methods and modalities to get to the underlying cause of problems as quickly and efficiently as possible. He believes in treating causes, not chasing symptoms, as well as giving patients the tools necessary to maintain and improve their own health. Dr. Scoppa's credentials incorporate a long and diverse list of specialization that all complement each other and his practice. After earning his BA degree from Seattle University, he earned his Doctor of Chiropractic from Palmer West, which is the West Coast branch of the founding school of chiropractic. He's gone on to earn numerous postgraduate certifications and advanced training in many areas, including becoming a certified SOT craniopath, which is Sacro Occipital Technique, and we'll hear more about that. He's the only certified craniopath in Washington State and the only doctor in Washington State certified in SOT. He has a certification in applied kinesiology and is the only doctor in Washington certified as such. He's certified as a chiropractic sports physician. He has Rocktape's FMT, myofascial taping certification. He's certified in multiple forms of craniopathy. He's taken advanced courses in non-surgical and holistic TMJ and TMD analysis and treatment, and we'll hear more about that. Advanced training in functional lab work, interpretation, and blood chemistry, assessment and management of gut dysbiosis, advanced training in pediatrics, metal toxicity and food sensitivities, the diagnosis and management of hypothyroidism and Hashimoto's, sports performance enhancement, concussion recovery, management of hypermobility disorders, and rehab of the spine. In addition to all that, Dr. Scoppa is an active member of the following professional organizations: SOTO USA, which concerns SOT, the International College of Applied Kinesiology, TMD Alliance, and the American Equilibration Society, which is concerned with dental disorders affecting occlusion and TMD. He's also the team chiropractic doctor for the Rainier Beach basketball team in Seattle. So welcome, Dr. Scoppa.
Hey, thank you. Thanks for having me.
Yeah, it's a pleasure.
Yeah, I'm flattered. Thank you.
With all of the information that I have about you, there's more that I don't and that intrigue me. And one of the ways that I became familiar with you was by, of course, going to see you. And even though I've been to other chiropractic doctors and have even had sacrocranial work, your approach was unlike anything I'd ever experienced, and also have found it and continue to find it extremely beneficial. Can you start by explaining how you approach, well, I'm going to say SOT because that's where I first became acquainted with your practice. So can you explain a little bit about how you approach that?
Sure. Yeah. I mean, when I was in school, I was lucky enough to kind of get into some circles where they were dabbling, and there's maybe hundreds of chiropractic techniques. And so in school, you're exposed to a lot of different methods, and the schools teach you how to do the manual chiropractic adjustments, and you learn the anatomy and the physiology and all that. But in terms of actually going about finding what to adjust or when to adjust, right? That's the schools kind of leave that alone. So it's up to students to kind of go out and find or not find a technique that they can use to kind of put things in a framework, so to speak, so you can assess them. So you're not just guessing and kind of going after things. And after you've been practicing for a while, you kind of develop your own style and that kind of thing. But I gravitated towards SOT and then the applied kinesiology, those two. I just saw the doctors practicing, and it was the type of practices that I wanted to have, and they were getting good outcomes, and so I went towards that and started taking a lot of those courses as a student, so that when I graduated, I was ready to take the certification exams and that kind of thing and really get started with that. And then like a lot of the other guests, I think, I've heard from your past podcasts, I mean, a lot of it was just kind of, I guess, chance, luck. I don't know what you call it. You just end up meeting the right people at the right time, and they you learn a little bit of this and learn a little bit of this, and then ultimately through experience, and you kind of put it all together. But for me, the framework is SOT, and that's I don't do a lot of strict SOT anymore. I teach for SOTA USA, and so I think it's a really good base, but the philosophy of it I follow. I think it's fantastic, but I kind of add bits and pieces to it, as I've gone along. So,
can you explain for the listeners who haven't experienced it what it is? And you mentioned it has a philosophy. Can you give the background on what that philosophy is?
Sure. Yeah, Sacro Occipital Technique was developed a whole while ago by a guy named Major DeJarnett. So he was an osteopath, an engineer, and a chiropractor. So he has a really fascinating story, actually. He's a really smart guy, obviously. But so he took a lot of components of osteopathy and kind of mixed it with chiropractic and kind of did them together. So he learned a lot of the cranial work and things from the guy who developed cranial work. His name's Sutherland. And so they kind of worked together for a long time. And he tried to simplify a lot of the things that were going on with the cranial work and make it more structurally based, rather than energetic, I guess you would say. So SOT, the main philosophy behind SOT, they split things into categories. So essentially there's 3 categories, right? And so the category 3 would be a soft tissue disorder, it could be like a disc herniation or something of that nature. Category 2 is more dealing with the SI joint, which is right next to the sacrum, kind of on either side of the pelvis. And category 1 is dealing more with dural torque. The dura is the outermost layer of the meninges, which is the covering of the brain and spinal cord. So it's more, you can think of it as more like central nervous system tension. And so, basically you're trying to get as much stability within the SI joint and then the jaw, because those have such a profound effect on the way that the rest of your body it is in space, essentially. So we found that if you can get a lot of stability in those areas, a lot of other things are easier to clean up after that.
So I'm going to backtrack. I want to go more into the specifics of the techniques, but I'm going to backtrack to your point about chance and how things land us in certain ways and on our path and such.
Yeah.
You began in law, studying law, or you took the LSAT, correct?
Yeah, I took the LSAT, did pretty well, and I got a scholarship, to school. I was ready to start, and I don't know. I just thought that would be an interesting path. I still think I would have enjoyed it. I think it would have been good. It was just, but I shadowed a bunch of lawyers the summer before I was going to start, and a lot of them told me don't do it. They were not happy. They'd been divorced 12 times. I mean, they were just really adamant, you shouldn't get into this, they weren't happy with their own lives, and they were telling me that, which I appreciated. They were very candid. I appreciated it. And so it scared me a little bit. And I was like, oh, okay, well, maybe I should think about this before jumping into this, right? Before starting anyway. Yeah.
And then you went into teaching. Is that right? Is that what happened next?
Well, I didn't know after the law, I didn't know what, I wasn't sure where to go from there. And so I actually had a teacher, he's a priest, a Jesuit priest at Seattle University. He was my advisor. And so when I said, I told him what happened, and I was like, I'm not sure what, and he knew I'd like to travel, and I'd done a study abroad trip when I was in school. he suggested I get my just like teaching certificate and you can teach English overseas. And he said, you know, it might be fun. You know, you earn a little money, you travel, kind of clear your mind, and then you could really think about what you want to do seriously, like what's your next step. And so that's yeah, I went to Seattle Central and got that little it's in the summertime, got my teaching certificate thing, and got a job in China, in Suzhou in China. It's like an hour from Shanghai, and didn't speak a word of Chinese and went over there. Yeah, this is fun.
Um, that sounds very logical in terms of the progression to me. What then I don't have a connection to is how you went from that, which I see as an amazing experience, to
Yeah.
healthcare. Yeah.
So I'd always been interested in healthcare in terms of my own healthcare, and I was an avid rock climber. So it's, you know, you have to stay pretty fit to be doing a lot of that stuff. And so diet and exercise, and I was always interested in those kind of things. I hadn't ever considered it as a career. It was just something I did to keep fit and keep, you know, to be able to practice my hobby, you know, what I enjoyed doing, which was rock climbing at the time. And I was a soccer player for a long time as well. So I mean, I was always kind of in that world.
Mm-hmm.
When I was over there in China, I ended up working for some businesses and kind of getting into that world and kind of dabbling in that. And then, yeah, I went and shadowed some Chinese medicine doctors when I was over there. And then I started thinking about it more and more. And I just decided, I think I would really enjoy healthcare. I'm kind of interested in that anyway. It's something I tend to have a passion for, right? I didn't even think about potentially making a living at it. And then, so I started thinking about there's so many different ways you can get into healthcare, right? I mean, there's so many different paths that you could take within healthcare. And so I started really diving into that. And I knew I didn't want to be involved with prescription drugs, right? I mean, I think they have their place, but it's just not something I wanted to pursue.
Mm-hmm.
So, that was the medical doctor side was kind of out of it. Naturopaths and naturopaths can't practice in a lot of states in the United States. I don't know. A lot of people don't know that, but in Washington, they're everywhere. But in a lot of states, it's illegal to be a naturopath.
Wow.
So it's really limited scope of practice and where you can go. And so that kind of turned me off a little bit. The Chinese medicine, they're kind of in their own world with what they do. And so, it's interesting to me, but I wanted to be a little more, I guess not necessarily in that space, more what was familiar. So yeah, I mean, I chose chiropractic not because I was really enamored with chiropractic per se. It was more of the scope of practice. I really like how the osteopaths of like 50 years ago, 60 years ago practiced. So it was kind of a mix of chiropractic, naturopath, and a medical doctor, kind of all rolled into one. And it was a really, I just feel like it was very holistic, and it really respected the person, and a lot of the different things that can go into someone's health. And a lot of the, if you go to become a DO nowadays, it's unfortunately not quite the same. I mean, it's essentially the same as medical school now, with, a heavy emphasis on drugs and prescriptions. And so if you go to the hospital, you might see a DO, you might see an MD, you wouldn't know the difference, but they're kind of interchangeable now. But a lot of the physical medicine tools that they had, it's kind of a dying art, unfortunately. So that was kind of that was the model I wanted. And so it was really, chiropractic was just kind of a route to get me there.
Yeah. That's fascinating. And that makes sense in terms of how you practice, how you have your practice, because you bring nutrition and, I don't even know the right terms, but you bring a very holistic approach without any specific dogma, as I define dogma. It's really looking at the patient and assessing their need and then responding to it within your training and experience. So it's interesting that naturopaths aren't legal in all states. Wow.
I know, it's surprising. Yeah, a lot of people don't know that, and it's I think they have a lot to offer, and it's unfortunate. All that stuff is political. It's all in terms of what can and can't be. Chiropractors in Oregon can do minor surgery, but in Washington, they need some extra certification to do so. But in Washington, they won't let us use an ultrasound machine. So it's kind of it's all over it's just crazy. I mean, it's very political, and I think there's room for all in healthcare. And I think it's good to have diversity in healthcare. I mean, if everybody was doing the same thing, I think we'd lose out on a lot of, no one can do everything, right? I mean,
Right.
I've taken a lot of things like you mentioned earlier, and but that's the great thing about practicing in somewhere like Seattle is that there's so many great practitioners around here. So, it helps me to know a little bit about what other people do, so I know when and who to refer to who. And so I don't actually see people for all of those things necessarily, right? But I think it's just important to know, at least have a really good understanding of what other people are doing. You don't have to be an expert in it per se, but that way you can help serve your patients a little bit better. I mean, if I practiced in rural Mississippi, right, I might have to do all those things, but luckily here we've got a lot of good people around here to work with. So.
Yeah, and I would think that studying all the variety of areas that you have gives you the ability to have more depth with your patients, even if you choose to refer them on.
I think so. And I mean, I think people are very appreciative of referrals. They like that. A lot of people don't know where to go. I mean, they don't know, who to see for things, or they're seeing somebody they really like. They just kind of hit a wall in terms of their progress, and they're not sure where to go from there. And especially with things like, we talk about like thyroid issues and things like TMJ, those areas, temporomandibular joint disorders, things like that, there's not necessarily like in terms of I could say the general population usually doesn't know where to go for that kind of thing. And so, I think it's really helpful to have some background in those areas.
Have you noticed a shift in what people need in terms of healthcare since you've been a doctor?
Yeah, I mean, I don't know a shift in what people need. I mean, I've heard, like I'll talk to doctors that, have been practicing for 30, 40 years. And they said, back then, there's less screen time, there's less, driving, you have more of a work-life balance. Work tends to be more physical. And so people needed less, I guess what you say, chiropractic was more effective back then as a standalone modality because it was really just a physical thing. You just kind of keep your body physically, you just get the facet joints moving, and it's very simple because the nutrition, people are eating better generally. I said their stress, their work-life balance was better. There were less environmental factors in terms of nervous system stressors and things like that. Whereas nowadays, I think we're just bombarded with a lot of different things, and it makes it a lot more complicated. I think for the doc, I think you have to have a lot of tools in your tool belt, a modern doctor to really, I guess do your patients justice, I guess, to really assess what's going on with them, because a lot of times it's not just one thing. I mean, it's not just an emotion. I mean, a lot of people come in and they have physical symptom, but it's stemming from an emotional issue, right? Or it's stemming from a chemical thing or a food thing, right? Like it's showing up physically, but it's not necessarily, it's not something you would deal with physically that's going to, give you the result. And so, I know also different parts of the country, right, are different in terms of what people come in with, right? So, I mean, I'll talk to friends of mine that practice in the South, right, and they have a huge diabetes issue, and they're not the most educated in terms of their body. Whereas people here come in, and a lot of people are almost, they come in with like pages of WebMD, and it's like, man, okay. And a lot of people are up here are very, they really try and they make an effort. A lot of them are decently fit, and they're doing at least some, what they think is healthy in terms of eating and all that stuff. I mean, they're at least like passionate about what, whether I agree with what they're doing or not is different, right? But they're at least like trying, they're putting forth effort, right? And they, that's the most important thing. I mean, if you have that, then you can work with that, right? If someone's willing to do a little bit of work and have a little bit of self-discipline and things like that, then it goes a long way. And sometimes it's hard though with the tech people are very difficult to work with up here, I think. And that's, I guess, a pretty new phenomenon in terms of that, but they, everything's binary, right? Black or white. There's an answer to everything in their world. And they come here and it's like, they want a set diagnosis, and they want this, and they want that, and this is how you treat this. And it's like, well, the body doesn't, always work like that. I mean, there's a large gray area, and most of what's done in medicine today, modern medicine or alternative medicine, is there's very little research behind it. And I mean, you could find things to support either position. I mean, it really depends who's paying for the research and what's, and so there's, they get frustrated. And so you kind of have to bring them back and tell them, like, it's not black and white. The body's not like that. And they don't like that, but that's the truth of it.
Yeah, and it's funny. I'm also, in my world, I have a version of that because we live in an area with a lot of tech workers, and
Sure.
it's that emotional side is very difficult for that category, that stereotypical category, to deal with feelings, recognize what they are, and then when they recognize them, know how to process them. Yeah. So, and I'm not laughing because it's funny. I'm laughing because the human nature that we all have never fails to somehow surprise and amuse me, in our humanness.
Yeah, especially little microcosm groups, right? They all have, like I said, I mean, the pro of that group is that they're very motivated, and they're and very intelligent, and they're if you could get them to buy in to what you're talking about, and if explain it in a way that makes sense to them, then they're very motivated. So that's a good thing.
Yeah, and the problem solving aspect also, I would think.
Yeah.
What would you, as you were talking, I'm thinking of chiropractic medicine going through an evolution. If you had a magic wand to define chiropractic medicine, what do you think would be a good way to go forward in it?
Oh, that's a really that's maybe more of a loaded question than I mean, that is like in chiropractic, it's like there's all these groups fighting for what that means and what that I don't even know if I want to make a definition. It's a very political question, I guess. I said without even knowing. It's and there's a lot of people in chiropractic right now that want to keep it I guess very traditional in terms of chiropractors just do adjustments. They just do manual adjustments to the spine. That's all they do. And then there's others that are way out on the other side now that don't even do chiropractic adjust. They're chiropractors, but they don't even adjust anybody. They just do basically PT work. So they'll do exercise rehab. They'll do, ultrasound and all the, modalities, cold laser and all these different things, exercise-based rehab kind of things. And then there's, people kind of in the middle of that. And so it's a very political issue, but I mean, I would essentially say, we're focusing primarily on the spine, essentially the nervous system, which is housed in your spinal column and then within your cranium, right? It's your central nervous system. So I'd say it's a alternative method of assessing issues stemming from that, right? From a more structural perspective. If I can keep it as vanilla as possible, that's probably what I'd say.
Yeah. And I guess what I'm getting to also as you're talking is the realization that because there is such a diverse opinion, that when there's a diverse opinion on any subject, to me, it shouts for a need somewhere, a need in our culture, a need in our, human development, something. And so that's what I'm really curious about also is, how have we as bodies changed to the point where we now have all these diverse responses from your field, but genuinely every camp is still wanting to respond to these evolving needs. And that fascinates me because I don't know that we see that in every branch of medicine. Not being a doctor, I wouldn't be able to speak real intelligently on it, but from a patient, my observation is it differs.
Yeah, that's certainly different. The dental profession is very much divided in a similar way. Maybe I don't know about others per se. Those are the two that pop out to me. The physical therapy is another one. I mean, there's a big war waging within the physical therapy community, about are we primary care doctors, or are we just, do people refer to us and we're given a diagnosis, or do we, what's our scope? A lot of them now want to adjust versus just do the exercise and modality based rehab things. And so there's a lot of, there's a lot of politics involved. And ultimately, I think I said, I try not to get caught up too much in that stuff. I mean, it doesn't really bother me if physical therapists are allowed to do chiropractic adjustments. I don't, some people get really upset about that, right? Which I respect that. But, I think ultimately people are going to gravitate to the person that they think is going to help them. And so, if that's me or the next person or the next person, I mean, a lot of that is what you do. A lot of that's personality, and a lot of that's where you are. And there's so many factors involved in that. I think insurance has been a big factor in the change of landscape of healthcare especially in the last 15 years or so. That's been a, really big shift. I mean, they essentially dictate care, which is kind of scary because they have no medical background whatsoever. So it's, that's a big part of it. So a lot of what doctors are doing now, it's more based on, this is what I can get reimbursed for versus this is what works well, or this is what gets me gets me a result from a patient. It's more of, and it's understandable. I mean, you got to be able to feed your family, you got to be able, and so, but that's unfortunately kind of what a lot of the, I see as evolving now is it's more about reimbursement and what I can get reimbursed for rather than the result you're getting.
Do you have, and this is just personal opinion, not speaking for the industry or anything, but do you have an idea of what would be a workable solution around insurance and such?
I don't. I mean, that's there's so many factors that go into that. I mean, I would love to see, essentially we don't really have healthcare right now, right? We have sick care. So, I mean, in America, we have some of the best sick care in the world. I mean, if I'm going to get shot or run over by a car or something, there's nowhere else I'd rather be but the United States, right? I mean, we're great at emergency medicine, but anything preventative is just, it's like we have it, but it's not integrated within the larger system. And so I would love to see kind of mainstream medicine embrace a lot of the more alternative therapies for prevention, right? And work together, right? I mean, I don't see them as competing at all. I mean, I encourage my patients to go get their, go to your medical doctor and go get, I think they provide a service that I don't, right? And so it's, I think you just have to find the right fit. But I mean, ultimately, I think they're complementary, and it's just they're doing something different. So I'd like to see more of an acceptance on both sides of what the other one is doing, and then I think that they could work together. Like I said, I mean, there's emergency medicine, and then there's preventative things that are. They said that the mainstream is really failing at. I think they would admit that. So it's. That's what I'd love to see in healthcare. And just having the money aspect removed as much as possible, I guess. And so, like, if you're a patient and you want to go see this doctor, then you can go see that doctor, and maybe you have a copay or that kind of thing. But and then the doctor can treat you as he or she sees fit, and then that person gets reimbursed fairly. I think that would be. I mean, it sounds reasonable, but for some reason we just haven't gotten there. I said, and part of it is honestly the fault of the practitioners. I mean, in the 80s and the 90s, a lot of alternative healthcare practice, chiropractors included, but they overbilled for what they did. And so they basically were like, they spent 10 minutes with somebody, a lot of chiropractors have been, very little time. They'll spend 5-10 minutes and do a couple of adjustments and see you later, but they'll bill for like 30 minutes worth of modalities, and the insurance company would just pay. They say, okay, like they trusted them. Okay. And then they realize, okay, like this is crazy. And so they started now it's like the other way. I mean, now it's like not just chiropractors, but I mean, friends of mine, eye doctors, dentists. I mean, that essentially they have to hire 2 or 3 people just to get paid from an insurance company. And so it's like, it's gone the opposite direction now. So I think somewhere in the middle with a little bit of accountability, I think is good. But not to make it so difficult that you can't even, work with the insurance companies. I mean, I think, somewhere in the middle would be ideal, but I know myself included, I mean, a lot of doctors are going away from insurance because, we want the freedom to be able to treat our patients the way we feel like they should be treated. And we don't want interference from the insurance company, dictating that. But it'd be great to have, a system where you could accept patients with insurance, and then you can still practice the way you want to practice and still get reimbursed a fair amount. I mean, that would be the ideal.
Yeah. Otherwise, you're really penalized without any fault of your own. So yeah, the logical system doesn't seem like it would be that difficult, but sometimes simple isn't easy.
Yeah, exactly. I mean, there's politics, there's
Mm-hmm.
so many things involved, but yeah, I mean, I think everyone would, if you look at, just take an honest look at your own profession and yourself and say that this is what I'm good at, this is what I'm not good at,
Mm-hmm.
and then work with the people that fill in the gaps that, maybe you're not as good at. I think that would just benefit everybody. So,
Yeah.
yeah.
And I know that in your practice, you specialize in a few things, TMD and TMJ.
Mm-hmm.
And I'm going to ask you, after I ask the question, to explain how those are similar or different.
Okay.
And also you specialize in applied kinesiology
Mm-hmm.
and in sports medicine. Is that right?
Mm-hmm.
Okay. So how did those specializations evolve? Did you go after them because, for example, you're an athlete, or did they come to you from other reasons, etc.?
The applied kinesiology. So applied kinesiology is kinesiology is basically the study of movement. And so
Mm-hmm.
applied kinesiology is a chiropractic technique. But it's essentially it's involved in anatomy and really knowing your anatomy and knowing how muscles integrate with other muscles and the fascia and all these things. So, the technique adds other aspects of testing and other things to it, right? But the applied kinesiology bit is, that was partly what I got into in school was, you learn all these things in a lab setting, but how to integrate all of those things into a usable framework. That's where the applied kinesiology came in. The sports medicine piece, I just started treating a lot of athletes, and I was using a lot of the traditional modalities that a lot of sports doctors, sports chiropractors especially use, and I just didn't find I was getting the result I was looking for. And so that's where I started applying more of the principles of SOT, and some of the applied kinesiology and some of these other things. And I felt like I was really able to make big gains in athletes that otherwise were having issues, either for their professional teams or for their college teams. And essentially they were just using those more traditional methods, the doctors or the physical therapists, the chiropractors that the school teams were using. They weren't getting better. And so then I was able to kind of provide something different for them, in those cases where those things didn't work. And then I went and got that sports certification a couple of years ago, and that was more dealing with concussion protocol and on-field management of injuries and things like that. So I don't do a lot of that where I'm on the field and that kind of thing. I mean, especially around here, there's so many good physiotherapists and other people that I think are better trained for that. But again, it helps to know that world and understand it a little bit, especially with the concussions and things. So a lot of people are good at diagnosing concussion, but in terms of a treatment or something to do for it, that's where I think the work I do can come in. Then the TMJ work, a lot of doctors that are involved in SOT also work with dentists quite frequently. So it's a pretty common connection there. And so, I had learned there's a big TMJ component to SOT. And then the SI joint has to do with that as well. And the way the rest of the body functions. I mean, a lot of that has to do with the way we bite. There's some really cool studies about leg length. People that have a leg length difference, they'll occlude harder on one side versus another. And there's some cool studies in the know about that. So I mean, a lot of things go into the bite that aren't just, the teeth aren't just the teeth, right? I mean, it's connected. They're extensions of bone, extensions of the cranium, essentially. And so, if the maxilla is tilted this way, you're going to have a harder bite on the right side if your upper teeth are tilted, right? And so you know, so you could shave down the teeth on that side to make your teeth fit, but you've still got all that tension, right? Or you can deal with that tension. And then, so there's a lot of different dynamics to that. But I started going to a lot of dental seminars and working with a lot of dentists and asking questions, and you know, publishing some little case studies with them, and going instead of trying to get in their world as much as possible. I try to go to dental seminars whenever I can, 'cause I just learn a lot about the way they do it. And they said it's kind of the Wild West in dentistry. I always assumed there was like one set protocol for this or that or whatever, and it's really all over I mean, there's people that are all over the place doing so. So it's very interesting to learn and to see these different things. And some of them I feel like the rest of the body doesn't like as much in terms of what they're doing. And then other ways, I feel like the body likes, you know, it responds better to the therapy that's going on in the mouth. So it's been a learning, you know, learning process for sure with the TMJ stuff. And I said, that's probably at least 60% of my practice right now is working with dentists and TMJ patients and that kind of thing. So that's a big part of what I do right now.
Do you think because of the lifestyle changes that you mentioned earlier, the stress, the less life-work balance and all that, do you think there's an increase in TMJ issues?
Sure, absolutely. I mean, that's what I mean when I was talking earlier, like there's varying opinions about these different things. There's a whole school of TMJ thought. And so kind of back to your question, TMJ is the joint and TMD is temporal mandibular joint disorders. So that could be like headaches, neck pain, right? Like tinnitus, like all these different things. TMJ is actual joint. So, so there's whole groups that think that TMJ related issues like TMD is a result of purely mental emotional issues. That's it.
Wow. Okay.
They think there's no physical component whatsoever. And then there's another school that says that you know, the opposite. It's only physical, right? I think it's somewhere in between. I mean, I really do. From what I've seen, I mean, I have it on my form. I mean, a lot of the people when I'm working with dentists, especially, I mean, the people that are hardest to get stable, physically stable, are the ones that have had a lot of history of, you know, physical abuse, sexual abuse, mental, emotional abuse. I mean, they come in and they are just basically in a state of fight or flight, like a sympathetic stress reaction. I mean, that's how they live their life. And you can't heal in that phase, right? You have to get into what's called a parasympathetic. Your nervous system has two modes. And the parasympathetic is where that's where you heal. And they just cannot get out of that state. And they just have so much tension within their nervous system that it's, like I said, there's only so much that I can do. There's only so much the dentist can do to kind of get that right. But it shows up, and it's hard to get their bite straight when all that stuff's going on. And you could point it out to them, right? But it's hard to. It's easier to deal with a physical stressor or a chemical stressor. It's usually somebody else kind of helping you through that. But the mental emotional trauma, I mean, you have to be in the right mindset to deal with that and go through that. And you know, it's a lot harder, I think, to come to grips with, right? So.
Yeah. And that's part of your referral system then, I assume, that you help them with at least suggesting somebody they can go to for that part.
Yeah, we talk about it. And I've gotten better at that too. I mean, initially when I started practicing, people get very offended when I would bring that up. I mean, there's a stigma around mental health, unfortunately. But you know, when I said I've gotten better at explaining it over the years, that it's, you know, this is causing the physical thing. Like this is, you know, I tie it into their physical and the sympathetic reaction and the nervous system, and then they get it a little bit more, and it's not just in their head. It's like no, this is like tying into your your physical symptoms are real, like definitely, you know. And so it's just a different way of bringing it up and talking about it. And I said, I mean, and again, a part of it is just educating myself as to the different areas within mental health therapy. And I said there's different. So you know, if someone's really adverse to you know, the traditional kind of talk therapy, there's other things they can do that maybe are, you know, it's maybe that would be helpful for them, or just a better fit. So
yeah.
But at least they're kind of trying to start working through some of those things, which is important, you know.
Yeah. What is your it makes me curious about what your personal view of the human body is. What is your concept of what our human bodies are?
I mean, the human body is amazing. The more you learn about the body, the more you realize we know nothing. I mean, we really know
Mhm.
nothing. I mean, there's, in school and we'd have cadaver labs and we'd break down the cadaver and to learn these things, you have to break it into pieces, right? So you learn there's like the hamstring, there's the bicep, and there's the endocrine system, and there's the cardiovascular system. But what struck me, when I was going through the cadaver lab was that, it's all together. I mean, we break it up to learn it, but it's all connected. And it's, so I try to think about that as much as possible when I'm treating people. I mean, somebody will come in with a knee problem, right? But it's rarely just a knee I mean, it's usually coming from, maybe they don't have enough mobility in their ankles, which are supposed to be really mobile, and then the knee is not. And so the lack of mobility in the ankle is causing stress in the knee, or maybe it's coming from the hip not moving well or something down the
Mhm.
chain. And so it's like just looking at things from a global perspective, I think, is really helpful. And there's something amazing in the body that keeps things working that I don't think we can qualify or quantify. I mean, you cut your hand and it heals by itself. You don't have to think about it. I mean, you don't have to think about
Mhm.
breathing. You don't have to think, I mean, like there's something that sets these things in motion that,
Mhm.
really gets you thinking about higher consciousness and higher
Right.
things going on, God, or whatever you want to call it. I mean,
Yeah.
there's something that kind of sets things in motion that, I mean, and we've got our physical body, but it's also our mind and what's going on. And you just can't break it into just, it's insulting, I think, to, to
Mhm.
the body to break it into X's and O's and black and white. Cause it's just so incredible. And so it's, said ultimately, I see my job as just trying to get things to where the body can just start healing itself better, essentially, like getting it into a better place for that, and just trying to figure out what's the best way to do that. But I mean,
Mhm.
ultimately, I try to be as hands off as possible. Um, I don't want people to rely on me to get better necessarily, right? I mean, I want to provide some framework, but ultimately, um, the work they do, right, the proactive kind of stuff, and the diet and exercise and mental health and all these things, and I see my part of the job as just kind of helping people navigate that, and then getting them as stable as possible. Just kind of, the ship's kind of veering a little bit, and I just kind of nudge it in the right direction, and
Mhm.
they keep going. Yeah.
Yeah, thank you. That's really interesting. I've often thought that doctors have a really advantageous inside view of the physical mechanics of the body
Hmm.
because you see so many examples and you see both health and disorder.
Hmm.
And you, I've never thought of it quite this way until you were talking. But when I think in my terminology of body, mind, spirit, I think of priests, whether they're in traditional religion or non, as being a um, custodian, so to speak, of someone's spiritual practices.
Hmm.
Emotional, there's all kinds of therapy and such. Doctors really have that inside view of the body, which is miraculous. And so any angle that you take of the being, to me, presents some knowledge. And so in that way, I think you have such a special and privileged insight. Um,
I feel extremely privileged and humbled that people would choose me to work on them. You know what I mean? I mean, it is that there aren't a lot of professions where you can touch somebody, and that's such a powerful thing. And it's such a, you're invading somebody's space, right?
mhm.
And somebody's trusting you with that. And so it's, I think the physical part is a big part of it, right? But I mean, it's such a, I don't say spiritual, but I mean, I think of the work I do is, I mean, for me, it's like a meditation. I mean, I really just get in it. I focus on it, and I don't think about anything else. And I've gotten to where I can do that and kind of talk to people.
Mhm.
But
Mhm.
that's a big part of it too, I mean, I'm not a mental health therapist. When people get too heavy with things, I don't, I try not to say too much. I think I might make them worse, right? If I say it, you know, but I try to just listen. I try to just be just them being able to talk about those things and work through them while we're working on the physical, right? And then really respecting that innate intelligence that's within them, that you know, whatever that is that's causing the healing and whatever. I mean, I just try to get in touch with that as much as I can, and like I said, try to let the person, you know, if they want to talk about their ex or if they want to talk whatever they want to talk about, you know, their child or you know, maybe they had a loss or something. I mean, if they want to keep it light, we keep it light, but I try to just I think the communication bit is a really important piece. I mean, that's I feel bad because a lot of students they want to shadow. They ask me, can we come shadow? And I don't usually let people shadow unless I you know, really know the person we're working on or whatever. I've seen them a lot and that kind of thing, because I feel like having another person in the room really takes away that they don't feel as open to express themselves. And I think that's a really important part of the treatment. I really do. So I definitely focus more on the physical, but I think the other things I think that's just as important. And I don't necessarily feel like I'm an expert in that stuff at all, but I feel like it's important to acknowledge.
I think that's beautifully said. Beautiful. I think that's the intention of when we say somebody is holistic, and yet many who use that term aren't. And I see that you truly are in that. What, in your experience, would you think, if you could advise people to do habits and they actually followed through consistently, what 3 health habits, not sick care, but health care habits, do you think are universally beneficial?
Trying to think of, can I just list a few without maybe,
please,
just like, I don't know if I can narrow down I don't want to say like one's more important than another or something like this, but
go for it.
A lot of people don't drink enough water. Very simple thing to do. It's a very easy one. You know, a lot of people say they don't like the taste of water. I hear that a lot, which I doesn't really have a taste, I think. I don't know, but you know, I tell them just put some cucumbers in it or throw some blueberries in it, something like that. But ultimately, I mean, you know, you want to be drinking a lot of water every day. And I mean, the number one cause of headaches is dehydration. So it's like, I mean, a lot of things you can, you know, detox, you know, they'll spend thousands of dollars on these detoxes, or water is the best. Most of the time they're not even drinking enough water. So, I mean, I would start there. And then if you need to do that, you can do all those other things, but that's a good way to start. You know, there's a lot of debate about diet and what's the right diet. You know, I think if there's one size fits all, we would have figured it out by now. Humans have been around for a while, right? But I think generally, if people wanted to do one thing, I mean, I would say obviously less sugar, which, you know, a lot of people don't think of it, but rice and bread and even fruit, I mean, those are all sugars. So I would say generally less sugar and, you know, try to eat maybe 2 extra servings of vegetables a day, something like that. So, those are really important. And then trying to find something, I guess, I do think exercise is important, but I'd say, I don't know if I'm going to have a third one. I guess I'd say like, I think it's important to have some kind of I don't know a good way to say it. It's like a spiritual component to it. And it doesn't have to be going to church or going to temple or whatever, you know, anything. But I mean, even like a meditation, I mean, there's so many now research benefits of you know, non-denominational meditation, right? Just mindfulness training, things like that, I think that's really, really important. I mean, obviously not being too sedentary in your lifestyle is good. I mean, there's a lot of different ways to exercise and methods to exercise, and depending on what your goals are and all that kind of thing. But generally walking is fantastic. So say, walk more. And you know, I think meditation is a really important thing, like I said, and there's a million different ways to do that. I think a lot of people think of like sitting on a mountaintop with in the lotus position, like with a robe on and like chanting Om, but that's not what it, you know, it could be praying the rosary. It could be, like I said, just through your work. I mean, I get really locked in and focused and mindful about what I'm doing when I'm working. So I count that as a meditation. I mean, I think there's a lot of different ways to do that and a lot of different resources out there that are really good. So yeah, those would probably be I say keep it as general as possible. I'd say those would be the ones. Yeah.
I'm going to ask you a question about the very first thing you mentioned, water. The
Mm-hmm.
quality of water is up for discussion a lot in recent times. I don't know how far
Yeah.
back, but I've been hearing more and more of it weekly. Do
Sure.
you think what's your view on that?
Yeah, there's a big thing right now for like alkaline water. It's a big
Mm-hmm.
like, and I'm not a big proponent of that either. I mean, I think that could be just I mean, you look at the Dead Sea, it's very alkaline, but nothing lives there. I mean, it could, so it's, I think, you want it to be in a certain range, right? But ultimately, I think, I'd like people to focus less on, obviously you want your water to be decently clean. Don't get me wrong. I mean, you don't want lead in it and all this other stuff, right?
Mm-hmm.
But aside from that, I mean, I think just trying to drink more of it should be the focus, rather than is the pH low enough, or is all this stuff, is it clean? Yes.
Mm-hmm.
It's relatively free of things. Okay. Then just try to drink more of it. That should really be the focus, I think.
Okay. That's it. That's interesting. Okay. You've had a lot of different teachers through your time. And I had asked you for some people that influenced you, and many of the originators of the techniques that you are studied and certified in are some of the people you consider an influence.
Mm-hmm.
Do you see a commonality between your teachers in either their approach or personality, or what was it about them that you found inspiring?
So they had a lot of self-discipline, obviously, to do what they do, and to develop what they needed to develop. Obviously, they were, I feel like, um, I don't know the word to use, I guess. I mean, I feel like you have to come up with something different, I think is really, I mean, I don't think anything's 100% new, right? I mean, everything, you take bits and pieces of things and you develop something new, but it's influenced by other things. And so I think it's just having a good filter, I think, in terms of what, I think the more things that you learn, right, you develop a filter more and more and more, right? And so it's you want to kind of keep your core tenets, I guess, like those are harder to shake,
Mm-hmm.
but at the same time you want to add, be willing to add things and mess, and so I think just being malleable and open to things and ideas, but also obviously pretty dedicated and pretty organized and confident in what you're doing, but still kind of keeping a humble attitude, I think. I mean, most of the teachers I've had, I'd say not all, but most are, I don't know, they're confident in what they do, but they're also open to other ideas.
Mm-hmm. If somebody was listening and not knowing what voice was being used, the same could be said of you.
I don't know.
I think so.
Okay.
That's my opinion. Yeah.
Okay.
Because, when you had mentioned the founder of SOT, Major DeJarnette,
Mm-hmm.
he was an engineer also. Was that? Yeah.
Mm-hmm.
Your interest originally in law, it's a very analytical sort of field as well. And then bringing in all the diverse practices and making them your own and approaching it with confidence, absolutely, and knowledge, but also humility.
I was, like I said, I was really lucky to have a lot of really good teachers along the way. And so things happened that, I ended up transferring I was going to Palmer in Florida, and I ended up meeting my wife or whatever. And so I ended up moving to the school in California. And I just think, I feel like lucky to have gone to the school in Florida. I met a lot of people, but a lot of my major influences, the people that I really ended up just really having a pretty profound effect on me professionally, and personally as well. But I met out there, and I wouldn't have been exposed to them if I had stayed in Florida. So just all this stuff happens. It's just very interesting, the way things work, and you just never know who you're gonna who you're going to meet and how they're going to affect you and that kind of thing. Right. So, but yeah, I mean, just great teachers that took the time to really, answer my questions and communicate with me and work with me and, just impart on me what they know. And that was really, I said a lot of it's just luck and I'm just grateful that I met them. So, yeah.
Can you single out, not in terms of teaching, but advice that some of your influencers gave you? Could you single out maybe one of your favorite pieces, or I won't use the word best. That qualifier doesn't really work for me.
Yeah. One of my mentors, I mean, it was just, if you're doing what's best for your patient, you're doing the right thing, right? I mean, there's so many things going on with healthcare and the legality of this. Again, just be there for your patients. Just do the best you can do. That's all you can do.
Mm-hmm.
And I think that really took a lot of pressure off of me when I was first starting, because you just feel like at the beginning, you want to fix everything that's going on with this person, right? And it's like, you've got to meet people where they are. I mean, some people don't want to be fixed, right? Some people they just want a certain thing from you. And so ultimately it's like, just try to be what you want for what they want you to be for them. Right. So if try to meet people where they are and be respectful of their wishes and what's going on with them and you're essentially working for them, right? You're helping them. So that's try to keep that in mind all the time. Rather than kind of putting what I think they need. Right. I mean, there's some of that, right? I mean, I feel like that's part of my job,
right.
But at the same time, it's not everybody wants that. Right. I mean, some people come in and there's like, my diet's horrible, I don't want to talk about it. Right. And it's like, okay, fair enough. I might tell them like, hey, like, if you're open to it, I think there's some things that could be affecting your physical health. I'll bring it up. And if they want to talk about it more or whatever, but sometimes it's about developing a trust. Right. So, I guess from a business perspective, like, most chiropractors, like I myself am a small business owner. It's essentially just, I think it's so simple, but just keep your overhead really low and just, do a good job and be honest with people. I mean, that was kind of there's this one guy in California who I did my preceptorship with. Can I name him? Is that okay?
Yes, absolutely.
His name's Brant Pedersen. So he practices a positive motion chiropractic in Los Gatos. So I did my preceptorship there, but, yeah, I mean, he's just such an organized person, or whatever. He's just such a good business person. Like, he's got all his ducks in a row and he researches everything. And so it's great. Cause whenever I need to do something or whatever, like, I'm just going to ask him, because I'm going to ask Brant, cause I know he's done like hours of research on this. So it saves me a lot of time. And so I totally trust his outcome. And but he, yeah, I mean, he kind of the model that I run my office in terms of the way I do it. And that it was all based on what he did. And a lot of it is just, you provide really quality healthcare experience. Right. And you're not necessarily trying to, I mean, he gives an example of like, again, he kind of creates all these things, but you can have this sprawling clinic, and I see that a lot with doctors. I mean, they'll have these huge clinics with 30 people in the office and whatever. And, the headache involved with that. I mean, I said, sometimes just keeping things really simple and I mean, keeping your overhead low and all those things, you just have less stress, you have less issues. And a lot of times you end up better financially too. And so it's kind of it's all just a benefit. I mean, there's a really good, Yvon Chouinard from Patagonia. I like a lot of his books. I've really enjoyed, but there's a book he liked called Small is Beautiful. And that's kind of the same mindset, right? Like, rather than everything getting big, so keep it small, but like really, really high quality and really good. And I don't know. I like that. So
I personally do too. People talk about minimalism, and I think that word can be misconstrued, because I think that deliberate use of what we're going for is how I think of minimalism. And it also, as you're talking, fits into that kind of model, being deliberate and conscious about how you're making your choices. Yeah. What do you see as next for yourself in your practice or personally, or however you want to answer that?
got a couple of things on the horizon in terms of potentially working in some of the dentists I work with a lot, maybe being in their office.
Oh, wow.
And so we could work side by side. Right now, the typical protocol is I'll work with the patient will come here and I'll do as much as I can, in terms of, the structural work, and I'll have them put a little wax wafer between their teeth to keep them from occluding.
Mm-hmm.
And then they'll go directly from my office to the dentist's office, and then they'll lay back and then take that out, and then the dentist will make an impression or they'll adjust a splint based on the work that the tension out, and they can kind of move a little further along in their whatever process they're trying to do, right? Maxillary expansion or whatever they're trying to do. And so but it'd be great if they didn't have to do that and we can just be in the same spot. I mean, that would really be ideal.
Yeah.
And so that's kind of we're just a couple of people I'm talking to right now about doing that. Other than that, just kind of keep doing what I'm doing. I think, I don't know.
Mm-hmm.
I like where I am right now. I have a good work-life balance, which is really important for me. Spend a lot of time with my daughter. So yeah, I kind of like where things are in terms of that. So
Mm-hmm.
yeah.
Yeah. Yeah. Just for listeners, you have a wife and a 4-year-old daughter that you are able to create a life where you enjoy them, right?
Oh yeah, we spend time together all the time. I mean,
Yeah.
yeah, we're together all the time, and it's really fun. My wife works in Bellevue as well. My office is in Bellevue. My daughter's school is in Bellevue. So every morning we all come into Bellevue together, and then in the afternoon I pick everybody up. We go home together, and yeah, I really enjoy that, spending time with my family. Yeah, it's fun.
That's really neat.
Yeah.
Before we close, is there something that I haven't asked that you'd like to say?
I don't think so. No, I just really appreciate the platform, and I said I'm flattered that you think of me to be on your podcast. I listened to a lot of your other guests. It's a very, very distinguished crowd. So I appreciate you asking me. Thank you.
Well,
Thanks for having me.
It's an honor to have you on it. It really is. For people who want to learn more about you and also some of the modalities that we discussed, I'll have links in the show notes. But if somebody just wants to follow you, where can they find you?
So my website, structuralmed.com, www.structuralmed.com. And then I'm on Instagram and Facebook as well. So You can either look me up by my name, so Dr. Jason Scoppa, or by the office name, which is Northwest Structural Medicine. I'm about to come out with a TMJ, TMD specific website also.
Oh, cool.
So kind of keep an eye out for that. But that's going to be tmjspecialist.com. Should be in a month or so.
Oh, super. So we're taping early in April, and it'll be a couple months before we go live with your episode. So by then the site will be up, and I'll link to it as well.
Oh, perfect. Okay.
Yeah.
Thank you.
Oh, that's
Great.
super.
Yeah.
And your website has so much information on it. Your articles and your background of how you approach things is so beautifully explained on it that I think it's a resource for people to check out. I just wanted to add that.
Thank you. Yeah, I need to get in on there a little bit more and add some blog posts and things. But yeah, hopefully there's some helpful tips on there. I hope so. That's the idea.
Yeah. Keeping up a website could be a full-time job, right?
Gosh, yeah. I mean, it's tough. Yeah, we'll just get fresh content and keeping things interesting. Yeah, definitely. Yeah.
Well, thank you very much. I've thoroughly enjoyed the conversation, and I'm grateful that you were willing and able to spend the time. And we will talk soon.
Okay. Thanks, Jan. Appreciate it. Bye.